What's good, Hoopers? In this video, we're going to go over key information you should know regarding Joel Embiid of the 76ers meniscus injury and the surgery that was performed, so a little bit of an update. My name is Gabe Ignacio, doctor of physical therapy, board certified orthopedic clinical specialist, and co-founder of the Basketball Doctors. In this video, we're going to go over kind of the mechanism of the injury that Joel Embiid had, the surgery that we speculate that he had, what kind of to expect of his return, what his rehab is going to look like, and everything kind of related to that information. So we're going to get into it now. So in this video here, we're going to go first over the mechanism of injury. And it was when Joel Embiid was playing the Golden State Warriors. There was a loose ball, Joel Embiid dove to get the ball, and then as you can see, while the ball is loose, Jonathan Kuminga dove for the ball as well. Unfortunately, when he rolled over, you could see it forced Joel Embiid into hyperextension, slamming his knee kind of into the ground. And right when that happened, you could tell he was in some pain. He got up and then you could see he limped off. So it was kind of that hyperextension injury. And if you haven't seen our hyperextension injury, go check out the link below. We'll have a description of kind of some hyperextension injuries that happened in basketball. And for this specific case, Joel Embiid had a meniscus tear. So we're going to go over how it was diagnosed, what the diagnosis is, and kind of the anatomy of a meniscus. So typically, especially at this level, when you have a knee injury like this, you really want to rule out fracture first. And there's rules that you can check to see if you should get an x-ray. At this level, most of the time at the NBA, they'll get an x-ray first to make sure there's no fracture. But if you're saying you had this injury and you're not sure if you get an x-ray or get an MRI, typically the first thing you want to find out is, can you weight bear? Usually if you can't put weight for 4 steps, limping is allowed. But if you can't do that, you should probably get an x-ray just to make sure. Other things that you want to make sure is that you can bend the knee past 90 degrees. You don't have sharp tenderness of like the kneecap, the tibia, or like your lower leg bone, and the kind of like the outside of the knee where you have like a little bony prominence. It's called your fibular head. So you just want to make sure there's no fracture, get an x-ray if you're unsure, or you could just get evaluated by a healthcare provider and they can kind of direct you in the right path that way. But immediately, if you have noticed those symptoms in the first 24 hours, get an x-ray to make sure. And then, so now we're gonna get into what the meniscus is. So the meniscus is pretty much a cartilage that sits on the tibia, which is the lower leg bone. As you can see in the picture here, there's two, one on the inside or medial, and then one on the outside, the lateral side. Can have different shapes just because of how the anatomy is kind of formed. And what the meniscus function as is pretty much like a cushion and a shock absorber of force between your tibia and your femur. So it's kind of like a little bit of like a pad essentially. And what it also does, it provides congruency between the tibia and the femur. So it allows for better stability if you have a stronger meniscus. For Joel Embiid's case, he got an MRI, and the MRI showed a displaced flap tear of the meniscus. So there's different types of tears that can occur with the meniscus. And the big thing that we're trying to figure out is the type of tear, where the tear was, because that's going to dictate what type of surgery you had. So it being a flap, as you can see in this image here, it's a pretty much tearing of the meniscus upward into the tibiofemoral joint, and it being displaced, meaning it's no longer connected to its original spot. So it's probably floating in the knee joint. Again, all of this is speculation because we don't know exactly like per detail what the MRI showed, but all we know is that it's a displaced flap of the lateral meniscus. And with that being said, this is going to go into potential surgery options. So now we're going to speculate a little bit on what we feel the surgical options are for Joel Embiid. We say speculation because 76ers president just announced that Joel Embiid had a successful surgery, but he didn't disclose what type of surgery he had. So the two most common meniscus surgeries there are is meniscectomy and meniscus repair. Meniscectomy is just pretty much a fancy word for removal of part of the meniscus. And then meniscus repair is when you're able to actually suture and repair the meniscus to kind of its original state for the most part. There might be a little bit of cleanup, but you're actually not removing too much of the meniscus when you do a meniscus repair. So with that being said, we're going to kind of compare the two. Meniscectomy is better in terms of shorter rehab, but worse for long-term health of the knee. Meniscus repair is a tougher rehab, but better longevity for your knee. The reason that is kind of, it goes back to what we talked about, the function of the meniscus. So when you remove part of the meniscus with the meniscectomy, you lose out a lot of the function that the meniscus provides. So you get less shock absorption, less lubrication, and less congruency at the knee joint. So that can lead to early osteoarthritis of the knee, constant discomfort because it can get into bone on bone, and you just know that people over time have more issues with their knee joints as time goes by after the meniscectomy. For the meniscus repair, harder rehab because you go through a traumatic surgery and then you're actually non-weight bearing for X amount of weeks, usually 4 to 6 weeks depending on the surgeon, because they want to protect the site to allow it to heal. And when that happens, you have muscle wasting, muscle weakness, range of motion issues, swelling, a lot of issues that come up just because of surgery. So it takes longer if you get back to like normal daily functions and sport, but in the long term, you preserve a lot of those functions of the meniscus that it can benefit you for in the future. So that's pretty much the main big difference between the two. For Joel Embiid's specific case, with the displaced flap of the lateral meniscus, we speculate that he had a meniscectomy for a couple reasons. One, they said that it was a successful surgery and they expect a reevaluation 4 weeks. So with that 4 weeks, we kind of suspect that it's more of meniscectomy, because we'll go into this a little bit more about timeframes, but it's a shorter time frame for rehab initially. And if someone had more of a meniscus repair, we wouldn't expect really a re-eval until maybe like 6 to 8 weeks, because that's when they'll be starting to do more in terms of daily function. But at 4 weeks, we expect meniscectomy being more of a 4-week return to normal activities type of thing. Second, with the displaced flap, the likelihood of that surgeon being able to get that flap and put it back to its original spot and suture it down together is probably unlikely. Again, this is speculation because only the surgeon will really know when he's in there. So it might be easier just to remove the meniscus at this point and maybe do just cleanup and hopefully kind of shave down whatever he needs to so that the congruency between the tibia and femur is good. And then our third speculation is kind of a stretch, but with how the 76ers are performing this year and with the real chance of making a late playoff run and potentially championship contenders, it might make more sense for them and Joel Embiid to decide on doing meniscectomy for faster rehab and potentially return this year, versus meniscus repair, he'll pretty much miss the remainder of the season. So now that we know the surgery options, what does rehab look like? Pending that we believe that Joel Embiid had a meniscectomy. So we expect that Joel Embiid will just do initial recovery in the first couple days. That's just minimize swelling, protect the surgery site, make sure there's no infection. After that first couple days, we expect him to start doing a lot of non-weight bearing activities like range of motion, both flexion extension, quad activation, glute, hamstring, core, calf. Probably do some blood flow restriction training to really try and get as much of strength and size while he's non-weight bearing. And then probably in that first week, he will do some like standing, stationary weight bearing activities, progressing into normalizing walking by the second week. And then we hope by somewhere in the first 2 to 4 weeks, he's able to do all daily function without any issues. His range of motion looks great, and probably starting the steps of returning to straight line running, landing mechanics, plyometric training, and then over the next maybe like 4 to 6 weeks, 4 to 8 weeks, depending on how 76ers want to play it, is progressing back into skills training, live action training, 1-on-1, 3v3, 5-on-5, and then as he returns, limit his minutes. So that's kind of what to expect. So we do expect Joel Embiid to return this season. Again, this is highly speculation on that he just had a meniscectomy and nothing else. But from what it sounds like, the 76ers staff are very hopeful that he'll return this season. That's kind of our update with Joel Embiid. Hope you learned something valuable or something new with all that information. If you liked it, please like, subscribe, share with your family and friends. Help us reach more hoopers. Like I said, check the description below for any of the links that we described in this video. Like always, we are the Basketball Doctors. Let's ball for life.